now ask that the live stream is started. Please can I have confirmation that the live stream has started? Thank you. I would like to welcome everyone to this meeting of the Health and Wellbeing Board held today, Thursday, the 21st of July, 2022. For those present in the room, if the fire alarm sounds, please leave the building by the nearest exit and proceed to the assembly area in the car park. The agenda papers and other relevant documents for this meeting are available for public viewing on the Herefordshire Council website. The Council is streaming this meeting live on the Herefordshire Council YouTube channel and is making a recording. To ensure that recording quality is maintained, please speak clearly as possible and keep background noise to a minimum. Please ensure that mobile phones and other devices are turned to silent. Others are permitted to film, photograph and record our public meetings, providing it does not disrupt the business of the meeting. There are no other members in this room. Voting will be undertaken by a show of hands in the room. Only committee members present may vote. We have a number of people in attendance as virtual participants. Can I request that they use their raise hand function within the system if they want to contribute? Please note, we have needed to add several supplements to this agenda. This was due to formatting and collating challenges. Obviously, if anybody has any questions or concerns regarding this, please address them at the appropriate time. We also need to adjust the agenda if everybody is happy with that, as we would like to go to item 7 on the list first. So item 7 is to appoint a vice chairperson. Prior to the abolition of the Herefordshire and Worcestershire CCG, Dr. Ian Tate stepped down from the position as vice chairperson of the Herefordshire Health and Wellbeing Board. The board is now invited to vote on and appoint a new vice chairperson. This will be drawn from the newly established Herefordshire and Worcestershire Integrated Care Board, the ICB. This ICB has recommended a candidate, Jane Ives, who is proposed to take up the current vacant position of this vice chairperson of this board. Please can I ask for any other comments on this agenda item? No comments? Okay, so the recommendation is that the Health and Wellbeing Board appoints Jane Ives as its new vice chairperson. Can I have a proposer and a seconder? Thank you. Okay, thank you, Jane. Do you want to move that here, or you want to say?
No, I'll choose the time.
Okay. So the board formally recognises Jane Ives as the new vice chairperson. Thank you, Jane. So back to the beginning of our agenda. So we have apologies for absence. Do you have any apologies, Simon?
We have received apologies from Mandy Appleby, Ross Cook, Donald Freeman, Superintendent Edward Williams, Anna Davidson, Councillor Toynbee, and I believe that Councillor Hitchley will potentially join us for a limited time before we'll have to leave the meeting. Okay, thank you. So do we have any substitutes for those apologies? No, there is no substitute. No. Thanks.
Well, just saying that David Hitchley seems to be on the screen. Not right.
I also understand that Councillor Hitchener has to leave shortly, so thank you for attending. And if you have any comments you want to raise before you have to depart, just put your virtual hand up and we'll try and address them. Thank you. Okay, so item 2 on the agenda is the declarations of interest. Do any members wish to declare any Schedule 1, Schedule 2, or any other interest on the agenda items? No. Okay. Item 4 on the agenda is the minutes from the last meeting. The minutes of the last meeting was held on the 28th of March 2022. They're included in the agenda pack, and I would like to know if anybody has any concerns with those minutes. We've not received anything that we need to. Oh, David Mahaffey.
No concerns, just a couple of corrections. I don't think Francis works for the ECT anymore. And I was at the meeting in person as well. I wasn't there today.
Okay, so following those amendments, can I move that the minutes are signed of the correct record? All in favour? Yeah, thank you. Item 5 is the questions from members of the public. Have there been any questions received?
There have been no questions from members of the public.
And item 6, questions from councillors. Again, have we received any questions?
No questions received from council.
Thank you. Okay, so we move on to item 8. Item 8 is the proposed addition of a voluntary sector representative position on the board membership. In the meeting of the 28th of March, the question was raised if it was possible to add a voluntary sector representative to the membership of this board. An addition to the board's membership of this nature would necessitate a change in the council's constitution. The board is now currently consulting with agencies from that sector before progressing any further, and will look to bring this item back to a future meeting. So it is set, the recommendation is that the board agrees to discuss the item at a future meeting. Can we have a proposer and a seconder? Thank you, Christine. And all those members in the room? Four, yeah, so carried. Okay, here we go to the meaty part of the meeting, shall I say. It's the Better Care Fund year-end report for 2021-22. And I do believe we have Ewan Archibald, Service Director for All Ages Commissioning, Marie Gallagher, Project Manager for the same team, and Adrian Griffiths, the Business Manager. I can see Adrian, but I can't see you. And
I'm here, Councillor.
Good, thank you.
Ewan Archibald. So with your permission, I will provide a brief overview, and then Adrian and other colleagues will answer any questions.
Yeah, thank you, Ewan.
Members have, thank you. So once again, members will note that we've been slightly frustrated by the timescales to which we're obliged to work by the Department of Health around BCF. So we are presenting papers to you on the performance of the last year after they've already been submitted. Unfortunately, the deadline was such that we had to submit before this meeting. So those documents have been reviewed and submitted by chief officers under delegated arrangements. I can also confirm that, subject to any further view from this board, that we've already had confirmation that from the Department of Health that our submissions have been approved. I say that's formally subject to your approval, but that we've had very positive feedback from the department on our submissions. I'm going to make a few points of overview in relation to our BCF activity and performance last year. And then I'm also going to comment briefly on the new planning guidance for 2022-23, which we have just received this week. So as you'll know, there are in principle 6 pools within the Better Care Fund, and these are the current position of those is summarised on page 6 of your papers. However, you will notice that in fact only 4 of those are truly active, and there are 2 that are in effect dormant, and the resources have been allocated within the other 4 pools. If you've got any particular questions on that, then Adrian Griffiths will be able to answer those for you as we go through. So pleased to say that all the national conditions have been met in Herefordshire in relation to BCF during this period. And the great majority of targets set for us in Herefordshire have been met in full. One that hasn't been met is around maintaining low levels of admission to care homes. Our target there for the year was 408 admissions, and we've actually reached 485 in the period. There are a number of factors that have led to that being inevitable, unfortunately, two in particular to highlight. One is there's been huge and sustained demand for home care, particularly coming for out of hospital discharge during the COVID and immediate post-COVID period. With just an example of that, in the calendar year 2019, we demanded a total of about 1,750 hours of home care direct from hospital discharge. That figure had risen to over 7,000 in the calendar year 2021. So that whilst largely our market has managed to meet that demand, it has meant the ability to meet wider demand has been affected, and unfortunately that has led to a smallish number of people who over the period have had to be admitted into residential care when otherwise we would have hoped to for them to go home with a package of support, but that's not been possible. The other fact, particularly in the second half of this period, is that we've seen an apparent increase in acuity of people generally going into hospital, being admitted into hospital, and some of that then be reflected in a fairly significant increase in the second half of the period of people being admitted to nursing homes direct from hospital, and they need to go into nursing care, but it reflects a larger proportion of people with that level of acute need at the point of leaving hospital. So those two factors have been the main ones we think driving us not unfortunately being able to meet that target. We almost hit the length of stay target. The target was 92.4% and we reached 91.7%. All the other targets we've achieved, and there was good progress in a number of areas, including around reablement and the 91 days, with people still living independently after 91 days after discharge. Obviously, the BCF pools as a whole represent a very significant investment in core services and particularly around integrated and joined up services across our system. I want to draw particular attention to the very significant role locally of Talk Community, that innovative program which is reshaping our relationship and partnership and the role of communities in Herefordshire. Some of the things that the BCF investment led or indirectly supported was a significant growth in the number of Talk Community hubs. I think for the period we've captured that as 54, but I know it's Amy's on the call, it's risen significantly beyond that since then. We've had 50 volunteers fully trained as mental health first aiders and a further 150 volunteers trained in general mental health awareness. We've obviously seen the support and the further growth of the Talk Community Directory website, which includes, I think, 450 plus pages of focused on wellbeing, and I think 950 services of one sort or another. So that's some brief indication of the scale of the contribution and the growth of that to the wellbeing investment in our communities. So overall, of course, what we see is a very diverse, locally and comprehensive system of integration and a wide range of services which support the objectives of the BCF plan. There are, of course, challenges. Some of the continuing challenges include some further residual effects of the impact of COVID-19, including on demand going into hospital and also some continuing impact on the availability of workforce. More widely, of course, as everyone will know, we are still in a national and to a degree local workforce crisis with significant challenges for us locally across both social care and health services. We're particularly seeing that in social care around home care and retaining and recruiting staff into home care across our market. It remains very challenging indeed, and that has an impact on the wider system, but there are challenges for NHS and other partners as well. The other challenge I think we've got facing us over the next year or two, it's a positive opportunity, but it is also a challenge, is as we move firmly into the new ICS arrangements, we need to manage the translation of our well-established partnership working and investment through BCF into these new arrangements. And that will be exciting, but I'm sure there will be complexities in relation to that. So I do want to draw attention to the new Bcf Planning Guidance, which we've received this week. And as usual, the timescales are extremely challenging. So we've only just received it. The deadline for submitting all of it, or all of our material, is the 25th or 6th, I think it's 26th of September, which is going to be extremely challenging, particularly around the usual governance steps. So there are a few changes, not dramatic, to the core BCF material. Some metrics are being removed and a couple of others being added or extended. The main additional requirement, which is of considerable concern, is the requirement to submit a separate plan focusing on the capacity and demand around intermediate care. And that plan is supposed to cover the period from the 1st of October, as we understand it, in this year, and submitted by the end of September. So this will take quite a lot of work, and obviously transparently there is little time to do that. This also coincides with the work that we're doing around fair cost of care, and there is some read across to that, but more significantly there's a read across to the work that the council and CCG and Wye Valley partners are starting to do in earnest around our discharge to assess model and wider intermediate care challenges and opportunities, and how we use BCF investment to support that. So it does align with that, but the timescales are extremely challenging, and therefore, whilst we're confident of submitting the material, we're not so confident around some of the usual formal steps in terms of reporting to this board, though we would expect to report and the material submitted to the board. Some of the preparatory reporting timescales will be challenging. So it's proposed to liaise with the chair of the board and governance colleagues to explore how we can manage that pragmatically. And I think that's a summary of where we are and the upcoming position, Councillor, but I and Adrian Griffiths in particular will be very happy to answer any question.
Thank you, Ewan. This one's always a difficult report to look at because, as mentioned, it's already been submitted and you've had confirmation that it has been received. So what we need to look at as a board are there any further actions necessary to improve future performance? So I'll open that up to members in a second. Just a few points I want to add. That we are working hard in partnerships to recruit for the care sector. This is and has been an ongoing situation, and we really need to commit to this. As you've already mentioned, national data is suggesting that we haven't met our targets, but I would come back on that and saying we've only just missed out on them. And if we can try and move forward with more recruitment, hopefully we'll be able to achieve that. We need to embrace talk community, as you already mentioned again, Ewan. This continues to grow and we need to embrace this expansion. And I do thank Amy Pitt and her team for that great work that they're doing. Right, open it up now to board members. Are there any questions on this Better Care Fund report? Anybody in the virtual room? No. Jane?
Yeah, I've got a few, and I'm sorry, my computer's just switched itself off, so I've made some notes, but I'm hoping I've got the detail right. I just wanted to see if the plugs, the sockets actually working would be helpful. Yeah, I tried that one, and that wasn't work either. So anyway, I'll carry on whilst sort that out. So a few things. First of all, I think you said around the length of stay target being met, and I don't think that's the case before my computer switched off. It's the discharge to home target. The length of stay target isn't being, for all of the reasons that you say. And I guess we're all concerned about the swap from people going home to those who are having to go into residential care when that isn't their need. Do we have any data on the number of those people who do then eventually make it home And what does that mean to our 408 target? So if all of the extra is people who went into residential care because we couldn't support home care, did those people eventually get to go home, or did they stay in residential care? I just think that's an important fact for us to know. And the last thing I want to say was on the demand and capacity plan. We are doing a piece of kind of prevalence work right across the LCS, which I think should inform that demand and capacity plan for intermediate care. And it feels like we'll be in about those timescales, won't we, David?
It's,
Be tight.
yeah, it's the 21st of September, we're doing Appoint prevalence audit, so 25th, 26th of September submission is going to be
Tight. We'll see what we can do.
Thank you, Jane. Any other questions in the room? No? No? Any virtual questions yet? Mike?
Thank you. Thank you. And I just really ask about with the Better Care Fund moving forward. Is it possible to bring some of this to the Clinical Practitioner Forum so that we can have a system-wide discussion, particularly on the areas where we could be seeking to improve? I recognise some of them will already be brought, and talk community is a fundamental part of what we discuss at CPF. But it just would seem, I think, a helpful area, a helpful discussion that we could think around of how we use that forum to help develop and work with yourselves on the Better Care Fund. On certain aspects of it. I understand it won't be all of it, but it may be a helpful discussion to have.
By all means, absolutely. Very happy to do that.
Thank you, Mike, and thank you, Ewan, for confirming that. Any other hands? And virtually none in the room. The final thing I'd like to add is that, Jane just mentioned demand and capacity, and this administration and this council have committed to building their own care home facilities. So at present, we're still looking at sites, etc., but this will be something that we'll take forward in the near future. So, we are committed to making the right place for the right people at the right time. Okay, so the recommendation is that the Better Care Fund year-end report 2021 and 22 be noted and approved by the board. Can I have a proposer? Yeah, Jane, thank you. And a seconder, Simon, thank you. All those in favour? Yeah, thank you very much. So that has been carried.
Sorry, Pauline, could we just pick up that point around just trying to understand the information about people who went into a residential home, whether they eventually got home? I'd be keen to see that data. If we can take that as an action point.
Adrian,
You will add that.
yes, indeed, Councillor. Adrian, are you able to answer it now, or do we want to take it away?
No, I'm afraid we'll need to take that away, Ewan. That's not an easy thing to identify from the Mosaic data set. So it'll need a bit of number crunching. So I'll need to take that away and talk to the information team.
But we'll do that for you, Jane, and we'll get you an answer on that and share it with other members.
Yeah, if you can share it with the board, you, and that would be great.
We will do that, Councillor.
Thank you very much. Okay, so moving on to item 10, which is the Joint Health and Wellbeing Board Strategy Briefing. A briefing on the Joint Health and Wellbeing Strategy presented by Matt. Can board members, attendees and members of the public please note the supplement to this in the agenda pack, and it's 10A. And that contains the latest version of the strategy briefing. So I'll hand over to Matt.
Thank you, Chair. So I think many people around this room have actually been involved in this document. So what this just really sets out and provides an overview and some recommendations at the end of the paper is how we're going about the development of the new Joint Health and Wellbeing Strategy for Herefordshire. Our last strategy is now ended. So this really just sets out the steps we're going to take in Herefordshire to develop a new strategy. The Health and Wellbeing Board held a workshop on the 6th of June, an informal workshop to help inform and ensure partners around the room have the opportunity to feed into how we want to go about developing that strategy. And some of that is set out in this paper. I'm not going to go through it all in detail. I think the key things for me is how we need to make sure this is integrated within the work that's going on in integrated care partnership. And I'm sure David's going to talk about that in a little while. But the key thing for me is around the key principles that we want to follow in terms of developing this strategy. We really want this to focus on evidence. We really want this to focus on the need of our local communities. We really want to ensure that focus on prevention. And we really want to focus on that health inequalities agenda too. In terms of the workshop that we held on the 6th of June, there were some key messages that came out from partners. There was a consensus that the strategy should be short and concise, it should be high level, but it should be supported by action plans. So clearly we actually want to make a difference to our communities, and we want to outline how we're going to do that. And again, we want it to be focused on prevention and integration. It comes back to the integrated care partnership and the integrated care strategy. So there are several key steps that we want to undertake in developing this strategy. And I suspect we'll be regularly coming back to the board to update you on our progress and how we go about that. We are working to quite a tight deadline, but we are aiming to get the strategy completed early next year. Again, those steps in terms of the proposed approach and methodology, they talk about utilising the joint strategic needs assessment and the data that's available to us. And I think we recognise that there is lots of information out there already. There's already been lots of engagement with our communities. There's some really good opportunities to build on what's already happened. And we can utilise things like Talk Community and the voluntary sector and Health Watch and others to really engage our communities in developing the strategy. The timeline just outlines some of those steps, and the key recommendation is that we're going to pull together a task and finish strategy group. Because the timescales are quite tight, that group is actually already formed, but we really welcome this board to endorse that recommendation. And I guess the other recommendation is to support the development of the new strategy and the guiding principles and timeline that's been outlined in this paper. So that's all I was going to cover for today. I'd welcome any questions or thoughts from others before we read your recommendations.
Thank you, Matt. I really like this. I think we've got to address these action plans. We need to assess, plan, evaluate, implement and evaluate everything that we're doing. And I also think that it's going to be a challenge for you to get it all done in this short time, but I know you'll strive to do that. And we must remember that prevention is at the heart of all this, and we need to get to the front end and identify what the things are that we need to address throughout that action plan. So yeah. Questions, Jane?
More of a comment than a question. Really supportive of this approach, and I think if we're honest with ourselves, for our health and wellbeing strategies in the past, we've spent more time on the strategy and less on the delivery, and I think we've got to change that around. And I think the way that we are now working together through the One Herefordshire Partnership, I think gives us a real opportunity to do that. And certainly I see 1HP as a really large part of the delivery arm of delivering the strategy. So and I know that the partners who sit around the One Herefordshire Partnership Board are really keen to make sure we've got that connection between this board, the strategy, and actually what we're delivering as a group of partners. So I think this is one of the sort of missing pieces of the jigsaw that will help us all to bring all of that together. But I think we have to get more focused on delivery than I think we have been.
Yeah. And I have real confidence that that will happen with our new director. He's very, very structured and planned, and he will get his whip out.
I mean, I just wanted to come back to and say I completely
Proverbial
agree.
whip.
Well, I'll agree with you as well. But I think one of the first things we've started is to review the existing strategy and what has delivered as part of that. And I have to say, I think what you just said, I think is coming across that we do want to get the strategy right. We want to make a difference on the ground, don't we? That's really what we want to do. So I think it's coming up with a plan that we really do put in place, and it's the responsibility of all of us to do that, isn't it? Doesn't sit on any single part, so completely indoors.
Thank you, Matt. Any other questions in the room? No? Any hands up in the virtual room? No?
Michael Hearn, take us along.
Who, sorry?
Dr.
Oh.
Hearn.
Dr. Hearn, sorry. Amy missed you.
Yeah, happy to be a mic as well. Thank you, Councillor. So just to really want to endorse this, and I guess just really, Matt, just picking up the where we are with regards to the appendix and how we approach this. Really keen to, as Jane says, to operationalise this, and as part of that, be really helpful to understand the role of the people who are involved in any task and finish group to take this forward. I think one of the challenges we have is trying to make sure that we get all of our frontline teams to actually own this as we go, and I think that's important that those people on that task and finish group have a responsibility, I think, to work with various groups wherever possible. And I guess there is something, I guess the only thing that's potentially missing for me is how we also consider working with the local authority across things like housing and transport and all those other aspects of health that we kind of often don't always kind of see as a fundamental part of it at the start of the journey, but actually need to be a key part of any strategy moving forward. So, but otherwise, makes absolute sense. Thanks.
Yeah, absolutely agree, Mike, that employment, housing and environment are all really important in this. So yeah, we don't forget any of those things. Any other questions? No? Okay, so I'm going to propose that the board support the development of the new health and wellbeing strategy, and that we agree on the guiding principles, process and timeline for the strategy development, and that we also agree that the production of the strategy be delegated to a task and finish development group with the membership set out in Appendix 1. And can I have a seconder? Thank you, Christine. Okay, so all those in favour? Thank you. So that one is carried. Thank you very much, Matt. Okay, so we're moving on to item 11 now. And we have a double act here today. So this is the Integrated Care System Development Update and Integrated Care Partnership Assembly, terms of reference briefing. Today we've got David Mahaffey, who's the Director for the ICS Development, and Simon Trickett, the Chief Executive Lead for NHS Hereford and Worcester. Oh, such a title. And they are both going to introduce this item. So over to you, gentlemen.
So I'll go first. I'm going to make reference to Appendix 2 in the first instance. So Appendix 2 is the terms of reference for the new Integrated Care Partnership Assembly, which met for the first time yesterday, with Councillor Crockett chair. We went through the terms of reference and we largely agreed them with a small number of amendments. So I thought it would be worth highlighting those amendments now so members are aware of them and recognise that they will go on to be signed off and implemented. So paragraph 4.2, we will clarify the role of the 6 district councils in Worcestershire, recognising the difference between the 2 council setups, the Unit 3 authority in Herefordshire, the 2-tier system in Worcestershire. So we'll describe that a little bit more clearly. And we'll also add a constituent map as an appendix, so everybody can clearly see all of the bodies that will be representing both counties in the Integrated Care System Partnership Board. Paragraph 5C2, we talk about ICS behaviours, values and priorities. We're just going to reflect that they are under development at the moment. So we've got a set that were developed by the STP over the years, but the new Integrated Care Board and partners will be looking to refresh those. So we'll make reference to that in the terms of reference. And then paragraph 6C, we talk about making reference to the Integrated Care Strategy, which is clearly under development. And that will be produced by December of this year. So on similarly tight and challenging timeframes to the health and wellbeing strategy. But the positive thing is we are working together and aligned on those things, which is a great position to be in, certainly from my perspective and Matt's perspective, because we will be able to draw upon similar sources of information and really make sure things are joined up, not duplicated, and really adding value to our population. So beyond those changes, the terms of reference were agreed, and we will then move on to have the first meeting of the Integrated Care Partnership Assembly with the wider Assembly members on the 7th of October. That meeting will take place virtually via Microsoft Teams, and we will be sorting out kind of invites and the agenda for that meeting over the coming weeks. So people, please look out for that.
Thank you very much. Simon.
Thank you. Just to add a couple of points of context, if I may. So I think firstly, we've obviously been talking about this development for a long time now. This has been a few years at least in the planning, but on the 1st of July, NHS Herefordshire Mushroom Integrated Care Board became a statutory body. CCG disappeared. The Integrated Care Board has inherited all of its responsibilities and a whole load of new ones as well. I think we talked about that at our last meeting. The integrated care system is a number of different parts. The Integrated Care Board is one part of the system. Another part of the system is the place-based arrangements, and that's what Jane leads here in Herefordshire with the One Herefordshire Partnership. And another part of the system is the Integrated Care Partnership, whose prime job is to agree a plan and a strategy that we can apply across our two counties and across our wider health and care system. Now, critically, that is designed to be a bottom-up process. So I think it nicely is emphasised in the papers that actually this isn't going to do the job of the Health and Wellbeing Board. The role of the partnership and the Partnership Assembly is to encourage and facilitate some joint work between the two counties' health and wellbeing boards, but to build on the local strategies. It's that way round rather than the other way round. I think that's really, really important to emphasise. I think the final point, I would really congratulate members on their pragmatism and their engagement with this. I think I talked to lots of other people who are trying to set these types of things up all over the country. I think ours is one of the most developed, and it's one of the most developed because people have been very pragmatic, very supportive, and the relationships are really developing and emerging. And I think particularly between the two councils, it's great to see, and it will have a big impact on our wider health system if we can get alignment, people helping and supporting each other. There are things we'll do together where there are benefits of scale, just as much as there are things we will do where they'll have to be very different in Herefordshire because the population is very different. So I would just congratulate people on their work so far with this. I think it's really in a good place. It's exciting, and we're poised for liftoff now, aren't we? So we'll all look forward to the 7th of October and the first proper meeting of the Assembly.
Yeah, thank you, Simon. I really have to calm down because I am really excited about this. And after yesterday's meeting, I'm even more excited. And I thank you, David, for mentioning those amendments that we discussed yesterday. I think it's really important that anybody looking at these documents can understand them. And I think anybody looking, first of all, especially to the additional members, seeing Worcestershire had 6, and it's really good that you can identify why Worcestershire have got 6, and not to sort of discount Hereford in any way, which we don't. I think this is a really great opportunity to share and learn from commonalities with Worcestershire. And like Simon said, you know, we have many commonalities, but we are also very different. So those things will be addressed. And we need to get the best outcomes for the residents of our counties at place. So I think it's a really good step forward. David.
Thanks. I just wanted to say a couple of additional things in terms of what we're actually trying to achieve through the integrated care system, because I started on Appendix 2, and just go back to some of the content in Appendix 1 there, and particularly the 4 core objectives of becoming an integrated care system. I think it's fundamentally important that we keep going back to these to say, why are we doing this differently? Because the reason we're doing it differently is because previously there were barriers that stopped us from working in an integrated way. And this new legislation, the Health and Social Care Act 2022, has removed a lot of those barriers. So we've got the chance now to do things in a different way. So what we're trying to do, the overarching ambition, is to improve outcomes in population health and healthcare. So it's not just the speed at which we treat people, but population health, so how we keep them healthy you mentioned prevention, the importance of that. That's the first objective, to try and tackle that. The second one, which I think is possibly even the most important, is about tackling health inequalities and reducing health inequalities. So finding ways from the very beginning of health inequalities, and Francis and I were talking about it this morning, if people smoke in pregnancy, then you're creating a health inequality at birth for somebody, all the way through their schooling, with the house they live in, community they engage with, etc., right into NHS services and the speed at which we treat people and the inequalities that can be created by how quickly people access and the nature of their access to services. So the second priority is all about tackling and reducing those. The third one, we've got opportunities to work at scale, be more productive, and get better value for money. So Simon talks quite a lot about the importance of moving from a kind of competitive NHS environment to a collaborative NHS environment. So, under the old legislation, we would, as a set of commissioners, we would need to go out to market to commission services, even when it was obvious that the local NHS trust was the right place to provide those services. That's gone in this new legislation. We can, collaborate and providers kind of collaborate between them. So that's the third area. And then the fourth one is about recognising that between us, across our system, across Herefordshire and Worcestershire, we employ about 40,000 people in kind of public funded work. So it's about 20,000 in the NHS sector and the council part of social care, and then about 20,000 in the kind of the care provision market. But 40,000 of 800,000 population, that's 5% of the population. So what can we do as employers and as organisations to help shift the dial on the quality of those people's lives and how they engage with their communities to support the kind of broader social and economic development of our areas? But that's what those are the four things we're trying to achieve, and we'll do that by bringing up services across health and social care, mental health and physical health, GP, hospital, and tertiary specialist care that's provided out of our area. We'll really focus on the determinants of health, and we'll really focus on trying to get more sustainable care models in place. I think it was you who talked about the workforce challenge. We all see it. We've got something like 3,000 to 4,000 vacancies in the health and social care sector in our system. That's 3,000 to 4,000 jobs that local people could be providing. But the challenge is, for every vacancy, it puts additional pressure on other staff, and that puts additional pressure on people, wanting to leave the sector. So we've really got to tackle that workforce challenge, and that will help us have sustainable services. So those are just the additional kind of comments I wanted to make, so we all understand why we're in this and what we can get out of it for our population.
Thank you, David. I really agree. Nothing should be done in isolation, and we need to really embrace this workforce that we have and make them feel valued. And I think if we can do that by incentivizing them in any way, I think we really need to support that. Quite often the health industry is seen as not a vocation, as a stopgap for many people. But I really can't reiterate how important those roles are in the in the health industry. Do we have any other questions, comments, or concerns? Hilary, thank you.
Thank you, Chair. It was more a comment than a question, but just to really underline from those outcomes that you've identified for the ICS, that have been identified for ICSs, that real importance of this isn't just about health and care. It's about the whole infrastructure. It's about transport. It's about housing. If we don't actually get that right, we can do all the best services in the world from a health and care perspective, but it doesn't necessarily improve those inequalities and those outcomes. And I think it's really important in developing our own health and wellbeing strategy, which I'm sure Matt will do, that wider involvement of council services is part of that development of the strategy, and we don't just focus exclusively on health and care. Thank you, Chair.
Thank you, Hilary. Are there any virtual questions? No, can't see any hands up. Right. Okay, so The recommendation is the Health and Wellbeing Board consider the report in Appendix 1 and 2, and we have commented on those terms of reference. So I hope we're all in agreement with that. So if you have no further comments, Simon, did you want to say something?
No.
No, okay. Okay, so thank you very much. Right, let's move on then to item 12 on the agenda, which is the inequality group update. And I think we have Alan Dawson on the call to lead on this one. Alan, welcome.
Thank you, Councillor. I've got a verbal update on the work of the inequalities group, and I think this is really just an update ahead of bringing something more formal to the next meeting of this group. We're very close to having a sort of finalised plan that we need to do some wider engagement on first, and we'll bring back here. But I'll just go through some thoughts on where we've got to and give you an update on progress. So we formed the group last year for Herefordshire, and it reported to the One Herefordshire Partnership, and really trying to understand health inequalities in the county, agree some principles and some priorities, and ultimately develop a plan for delivery. It's a priority obviously for the Health and Wellbeing Board, as agreed here some time ago, and it's a priority also for the One Herefordshire Partnership as well. It's worth saying that there's also an ICS system level inequalities collaborative as well, and a system health inequalities plan is being developed that will essentially be built on the plans developed in the two places within the system in Herefordshire and Worcestershire. Just a word on health inequalities first. I mean, health inequalities are just to be clear about our shared understanding of it, that the definition that we're using around this are unfair and avoidable differences in health across the population, and that create inequalities and arise because of the conditions in which we're born and live and work and age. So that's very much the focus of the work we've done. We've agreed some principles when we first came together about agreeing a system-wide understanding in inequalities, using data to a population health management approach, and focusing on deprivation vulnerable groups and using best practice to work up a plan for Herefordshire. And we're kind of part way through that at the moment. So we've been building our understanding, we've been mapping the current initiatives, which I'll talk more about in a moment, that are going on around health inequalities in the county, completing a gap analysis based on that, and starting to work through some priorities and plans, which is where we are at the minute. In terms of the gap analysis that we've done quite a long and quite torturous piece of work, really trying to identify at every level across the entire life course of Herefordshire residents, what interventions are already in place around health inequalities. And it's a massive piece of work which we will share as part of the probably with Appendix in the final plan. I really just wanted to go through a couple of the findings from that. A number of gaps and barriers identified. I mean, first of all, what we identified was enormous and wide-ranging, but there's not any kind of single systemic approach to dealing with health inequalities. You won't be surprised to hear that there's a lot of issues around our staff that work in health and care, and their understanding of health inequalities and their training to deal with it. In some cases, we have a lack of population health management intelligence. Data on ethnicity is a classic example of that. We don't have that data right across the board in Herefordshire for our residents. Sometimes the way healthcare is organised causes problems. And as even though we're working in an increasingly integrated way, we still deliver many of our services in a siloed approach, and that again causes gaps in inequalities. There's no overall leadership on health inequalities, and I think that's where our group comes in, trying to steer the leadership on that. We have inequalities in our own workforce. I mean, I know my own organisation is one of the biggest employers in Herefordshire, and it's something that we've started to look at in recent times, but we need a more coordinated approach to. And we don't necessarily focus on areas of deprivation. So they're that's where we've got to in terms of the gap analysis that we've done. And now we're coming on to priorities and plans. And I think it's fair to say that there's quite a lot already happening in the county. There's been some big events happening with more of a focus on health inequalities and the prioritisation of it here and within the partnership. We've seen the prevention symposium in May, led by the diocese, and that continues. That's a strong empowerment theme there, and focus on vulnerability. And the Herefordshire Community Partnership, which forms part of the One Herefordshire Partnership, has had a focus on that, very much working with patient groups, public, and the voluntary sector on inequalities, and has identified 5 key themes around that, and ran a very good workshop in May, and are now delivering on some of those themes as a group. And our primary care networks as well, it's worth highlighting there that they've agreed health inequality priorities as well for their localities that they work within. So in terms of our plans and where we are at the moment, I mean, we're really trying to bring all of this together. I think some of this starts at the top, just strengthening our leadership and accountability. I think that our public health team, Matt in particular, who's with you there, is at pains to say that the first thing we must do is not contribute to widening inequalities. And there are a number of ways we can do that by looking at our local health policies and interventions that we do, making sure that we've done an impact assessment on those, and making sure that we're not widening gaps any further. And what we want to do here is develop a kind of leadership charter or overarching plan that describes what we want to do. Then there's some of the stuff that's nationally prescribed, the NHS in particular in the long-term plan. We also have the core 20+5 approach to health inequalities as well, which we wanted to deliver. And some of the things in that are things like restoring elective care, looking at digital exclusion, and making sure that our data sets are up to date, and we have all the data that we need to support us to make the right decisions. So something around that as well. There's something about supporting the work that's already going on through the community partnership, through the PCNs, and really delivering at that, because I think it's really important that we deliver at those kind of local levels, because health inequalities are different across the county, based around areas of deprivation and different needs in the city and rural areas. So there's something around that as well. And then something that we've been considering as well is focusing on our most deprived areas as well, which is the approach that's suggested, looking specifically at 6 most deprived wards in the county, and developing a plan around that. Like I say, all of this will come back to you at the next meeting in a lot more detail. So we just need to finalise that work. Be clear about what our deliverables are, develop that overarching approach for Herefordshire. We need to do a bit of work around engaging more widely on that. I think the community partnership are key to that, and so are the clinician and practitioner forum that Mike chairs. So we need to do some engagement around that. Bring that back to seek approval both here and at the One Herefordshire Partnership, monitor that through our group. And really, I think this is a precursor to work and will link heavily to the work around the health and wellbeing strategy that you've heard about today. So I'll leave it there and happy to take any questions.
Thank you, Alan. It's great to hear. Thank you. Do we have any questions in the room? Just wondered if, Jane, if you wanted to mention anything on the One Herefordshire side of it, but Matt, you put your hand up, so we'll go to you first.
It was just really an observation. I think firstly, thanks to the subgroup in driving this agenda forward. I think we have to recognise this is tough stuff. It's incredibly complicated, and it's going to take some time to resolve. I guess for me, it's just reflecting on the COVID-19 pandemic, and I think we've done some analysis. And I think in Herefordshire, I think people were 1.5 times more likely to die with COVID-19 from deprived communities and the least deprived communities. So this is real stuff. So it's not just about life expectancy. We're seeing it here and now. And I think there's lots of those inequalities born out throughout the pandemic. So it's just really, it's a great piece of work. It's not easy. And again, it's another one of those wicked issues that we all have to try and unpick and then, resolve ourselves. So but thanks for the work today. It's really my main thing.
Thanks, Matt. James, you want to
thank you.
Comment?
I guess there are a couple of things that I wanted to pick out of that. One is that we selected this as one of the 5 priority areas that One Heritage Partnership was going to be working on. So that's why we've already started this work and kindly leading it across the system for it. But a particular feature of it is around delivery at PCN level, because some of this is around personal relationships, the relationship of clinicians, voluntary sector, practitioners with individual people and families. That's where we make a difference. We can set all these strategies at this level as much as we like, but actually it's the conversations and the things we do as part of a personal relationship. So the PCNs are absolutely a focus for a lot of delivery on this. And I guess my other comment would be, I guess, in terms of the paper coming back next time, is we've got to be clear about how we're going to set priorities on this so that we can make the biggest impact. As Matt and Alan have said, this is a huge area. We're not going to be able to deal with all of it. So I'd be keen that we set ourselves 2 or 3 real things that we can do, we can make a difference to. Because if we try and do everything, we possibly end up doing not very much at all.
Okay, thanks, Jane. Okay, any other questions or comments, concerns in the room? No, anybody in the virtual room? No further comments. Okay, so I really think it's important that you identified, Alan, that we need to break those silos, break those down. I think we have to do that in all areas, actually, not just in inequalities. So if we can get that going, that would be great. I really look forward to the final plan, which will come to us in September, I think. And I think I am with everybody saying that it's a big agenda, and it's going to take some while to address. But thank you very much for your update. Okay, so for the board, it was just to note that we have had that update, so that's taken. Thank you very much, Alan. Okay, so we're on to item 13, which is the Health and Wellbeing Board Work Programme. And I think we've got Amy in the room, virtual room, and
yes.
she's going to present this.
Yeah, thank you, Councillor. Thanks, Chair. So yeah, this is just a bit of an update in terms of how we'd like to forward plan for the board for the next sort of 12 months. You'll see in the Appendix 2, it gives an overview of some of the areas that we could consider and some of our statutory responsibilities as the board. And then Appendix 2 gives an overview of some proposals for the next sort of next few meetings. So it's really an open discussion today with the board as to, in terms of Appendix 2, whether we've kind of got it right for the next, up until the end of March next year. And if there's any additional items that we would like to include going forward in terms of either the ICS planning or any other thing from other organisations we feel would like to have here at the board. We've also scheduled in some private workshops, so one in September, one in November and one in February. The private workshop session for September is already starting to be scoped and worked through at the moment, but obviously we haven't got anything planned in for the 14th of November or the 13th of February. So it's really an open discussion with the board today, just to, like I said, to see if we've got them, if everyone's in agreement with what's been proposed, or if there's any additional items we feel the board needs to hear.
Thanks, Amy. Do you know what? When I looked back at what we already covered in the last year, I was quite impressed. You know, you tick along and go to meetings and do stuff, and then when you look back, you think, oh my goodness, it was quite a busy year, even though we were racked with COVID, etc. And March next year will be here within a flash. I know that. So again, I thank you for this forward plan. David.
It would be incredibly helpful if we could spend some time on the 14th of November going through the integrated care strategy. And then perhaps potentially on the 12th of December have a formal endorsement of it from the Health and Wellbeing Board before we publish it at the end of December.
Yeah, I'm sure we can accommodate that. Amy?
Yep, that sounds absolutely fine. Yep.
It's really good because this is the way we need to move forward, you know, so that we can all get the most out of it as we possibly can. Jane?
What Dr. Allen just said around the inequalities work coming back, so I think you're suggesting that comes to the September meeting, Alan and colleagues. So we need to get that on then. And the other thing I'd like to suggest, and again, it's in terms of making that connection between the One Hertfordshire Partnership and the Health and Wellbeing Board, is that we provided a twice a year update on what we've been doing, what we've been delivering, and hopefully it'll all connect because it'll be the priorities that we've set and is how we're working on delivering them. So I'd be quite keen to provide that update a couple of times a year, and particularly once we reset the health and wellbeing strategy next year, it'll become even more important in the future. But happy to do that in probably the December meeting. I would have thought. I don't know how fixed those dates are, Amy. They say that they're TBC still at the moment. Are they pretty fixed, or are they still move around a bit?
We can move them around. Simon, you're probably better placed to comment on that, but I'm guessing we can juggle them if needs be.
Yes, it can be moved around.
Yeah, it was more almost my point was the other way. It feels like we ought to have them set. So rather than that we keep moving around. So but we'll sort of aim to do something for the December one and bring an update for us all.
Yeah, so if we can get those in the diary as soon as possible, and then we all know, where we're moving towards, that would be good. Simon, Matt, who are you?
It's just a quick one from me, and one thing that I've done quite successfully elsewhere, it just builds on your point, Councillor Crockett, is how we celebrate success as a board. And I was just wondering whether we perhaps look to have some kind of health and wellbeing conference, maybe early next year, to actually reflect, because there's some really good work going on, isn't it, across the system. I don't think we always celebrate it as well as we should be, and it could be just a virtual conference, we pull some videos together illustrating what we're all doing. Hopefully we have achieved lots. So I just wonder, maybe we can think about that. We don't need to agree a date now, but whether the board might think that would be something we might want to do and go out to the communities to say it's what's going on. So it's just a thought.
No, absolutely right. We need to shout about what we've done. So unfortunately, a little bit more work for you, Amy.
Yeah, I'm happy to. I think that's a really good idea, and we can tie that into maybe the PCNs and other work. So yeah, I don't really like that idea.
And I'm sure you'll liaise with Matt. So we'll wait for that one. That'll be really good. Christine.
That to work. I was just wondering, this might come into Jane's suggestion about One Herefordshire, but hearing more from PCNs and how PCN development is going and some of the real tangible things that are happening in terms of population health management or local would be quite good, I think, to hear.
Yeah. I think we're capturing all that, so we will add that into the debate and discussion.
Yes, that's fine. Makes sense.
Simon?
Just a really quick question and probably a bit of a challenge. Does our forward plan appropriately align with the forward plan for scrutiny? That's one of the things I've always been very conscious of in the Health and Wellbeing Board setting. We need to do a different job to the Scrutiny Committee, and the Scrutiny Committee should do a different job to us. So talking about a setting strategy, I think that's what we're here for. Kind of scrutinising and challenging delivery. That's what the Scrutiny Committee is. So just we need to make sure that kind of we've got the right plan and a complementary plan to that of the Adult Scrutiny Committee as well. Just a plea, really, I guess, so people like us don't end up having the same conversation a few times over, really.
Yeah, I think that's a really relevant comment.
Yeah, I know and I probably didn't cover it in my update for the health and wellbeing strategy. We are obviously going to scrutiny as part of that development. So throughout that process, they get that view. I think that's really the point.
Yeah, nobody likes duplication.
We don't mind.
No point.
But there are better things to do.
Absolutely. Yeah. Okay. Anything else from the virtual room? No. No. Any further comments, Amy? Do you want to?
No, that's fine. I'll work with Simon and update that and circulate that as part of the minutes.
Okay, so it's just that we the recommendation for this is that we accept the work plan, ambitions and needs set out in Appendix 2 and approve and support it here at the board. So can I have a proposer? Simon and Jane will second. Thank you. So everybody in favour for? Yeah, nobody against, obviously. Thank you. Okay, so my goodness, we're on to item 14, date of next meeting, and the next scheduled meeting is September the 26th. Oh no, sorry, Dr. Francis Howie. I'm so sorry. I meant to bring you in on
that's
that
absolutely fine. We can do it as any other business. So would you like me to?
Yes, please.
But I just wanted to give the board a little bit of briefing just about the pharmaceutical needs assessment item that's coming next time in September. So it was just so that you are aware of the process, because we have got a statutory duty to publish one by the 1st of October, and people here will be involved in preparation and presentation of previous ones. We are currently in a process that's driven by statutory guidance, and a number of those duties around consultation and preparation have been delegated to a working group jointly with Worcestershire across the system. So that's all been chugging on behind the scenes. We've already done a public survey. We've already done a contractor survey with existing pharmacies, and Health Watch have been involved in that delegated group. The point we're at now is we are about to go through a statutory consultation process with statutory consultees, including the local pharmaceutical committee, local medical committee, pharmacists, dispensing doctors, Health Watch, NHS trusts, NHS EI, Neighbouring Health and Wellbeing Board, ICB. So, you know, people here, it will be landing in the inbox. It will actually be a hyperlink to a document. There are then 60 days to respond to that. And then we bring the final version back here on the 26th of September, having responded to any consultations that come, any responses that come in at that stage. So I'm wanting you to be aware that this is a tight deadline. So on the 26th of September, I seem to have my name against a number of items, but I'll certainly be wanting to pay some attention to that pharmaceutical needs assessment, where we will be making the very final comments, which will need to be turned around for the 1st of October. Okay.
Thank you, Dr. Harry, and I'm so sorry. I can't believe.
No, this was just
can't believe I nearly left you
anyway.
out.
No problem.
And you chugging along is sort of, putting it mildly, you're doing an amazing a lot of work, as we will see in September. And again, sorry. Okay, so that date is September the 26th. So if there are no further comments or questions, concerns, I will close this meeting. And thank you all for attending.
Good question. On the 14th, is it the morning or the afternoon?
On the when?
on the day